Hey, Miss Adelman, this is Sam. We're going to be doing another skills video today, going over intradermal injections. And first thing I'm going to do is I'm going to practice proper hygiene technique. And I'm also going to don procedure gloves, but for the sake of saving procedure gloves, I'm not going to use them for this time being. But if I had them, I would use them. So I'm going to make sure that I've got all my proper materials. So I'm going to make sure that I've got proper medication, check the MAR label, make sure I got a doctor's order to administer this medication. I'm going to make sure that I've got the proper syringe. I would open it out of the package if it was in the package. I've already done one or two of these videos, so hope you don't mind me reusing this one, because this is take number 2 or 3, so I do apologize. But a 1 ml syringe, 28 gauge needle for this particular injection. Also, with intradermal injections, you're generally going to administer 0.1 to 1 ml. That's why I've got a 1 ml syringe for this particular procedure. After I've done that, I'm going to uncap my vial, clean it off with alcohol, make sure that it's sterile, and I'm going to prepare to draw up this medication. So, and the whole time you're doing this, you want to make sure that you're using proper sterile technique. So I'm going to draw up 1 ml to administer, and I'm going to insert this into the vial at about a 15-30 degree angle. Once I've broken the label, I'm going to go straight down. I'm going to turn it upside down, push the air. I will draw up 1 ml before I actually draw up my medication. After I've done that, I draw up 1 ml of this particular medication, put it back, verify. Okay, this is 1 ml, and generally this procedure is used for like TB tests and stuff like that. So I'm going to recap just like that, 1 milliliter. And now I'm going to prepare for a site of injection. Don't have an actual patient I can do this on, so we've got an orange. After I have, when I'm choosing a site of injection for intradermal procedures, generally you want to use either the lower ventral side of the forearm, the around the upper chest by the clavicle, or the scapular area posterior on the thorax. You want to use areas that don't have a whole lot of adipose tissue, because we're not breaking the skin very deeply. So once I've done that, I'm going to so if I was doing this, I would choose the ventral side of the forearm. I'd clean it off with an alcohol prep. After I've done that, I would wait until the site has dried, and then I would prepare for injection. So clean it off, wait till it's dry. Okay, it's dry. Now that we've got that, I'm going to uncap my medication, or my syringe, And I'm going to go at an angle about 5 to 15 degrees. Once I've done that, and before I inject, I'm going to take my non-dominant hand, pull the skin tautly, and insert about 3 millimeters. And then it should, once I'm injecting, it should like kind of bevel up or swell up at the side. I'm going to release tension and make sure not to aspirate. You don't want to push too fast. You just push nice and slow, just like that. Now I'm going to remove from the site of injection, recap, just like that. And I'm going to have a little piece of cloth with me or something to pat the site in case it starts bleeding. Make sure that the patient tolerates the medication properly. Assess their condition after administering the medication, and once all of that has been accomplished, you will make sure that you leave them in a position of comfort with the call out available. Ask them if there's anything else that you can do for them at this time, and reevaluate their condition, and that's it. So thank you for watching.